Well, first of all, thank you very much for introducing me to speak. I can see that you've got a really packed and interesting program, so I'm grateful even just for a short time that I get to speak and be with you. So thank you for that. I am Michelle Wilson Chalmers. I'm the knowledge exchange broker for SPHR. I won't go tell you too much about my background apart from, as well as this role, I also teach science communication and public engagement, and I was also a previous researcher myself in a past life. If you do want to know any more, at the bottom of the slide is a little bit more about me anyway. Okay, so in this brief 10 minutes I'm with you, I'm going to share a few knowledge exchange tips and advice that I've learned over the years, highlight a good example, and the example actually I've chosen, you'll see shortly, has turned out to be quite a good example. I'm going to outline where you can access bespoke support, because there is support through SPHR should you need it, and then also signpost some more general resources that are available. And there are quite a few links in the slide, so hopefully when they're shared at the end, if you want to look further, you should be able to. Okay. So the tips, I've kind of split these, and I've tried to be quite trendy here and split them into 3 R's. They don't quite work, if I'm totally honest. The top R, really, I wanted to use plan, but it kind of ruined the niceness around it. So just humour me for now. Many of these tips actually we already heard in the really interesting panel discussion that started, so that was really, really nice to see them in practice. For the first one, research, I would encourage everyone to think about what it is you want to achieve. Try and plan knowledge exchanging at the beginning, the same as you would when you're planning out your full research project. The earlier you plan it in and think through how it will work, in my experience, the more effective it will be. I'd also encourage you to kind of we get so focused in research, I would encourage you to step back and look at that bigger picture. It may be that your particular research crosses over different areas. It may fit in health, it might fit in environment, it might fit in transport. It could fit in lots of different areas. So that may help you when you want to share it later on to engage with something that's really topical or of interest at the time. I would, I think one of the panelist members said it, do your research, get to know your audience. I kind of think of it as doing a bit of research on my audience. What are they interested in? What do they want to know? Where are they? What could make them comfortable? And be realistic on what you can do, time, budget. Generally, that helps with managing expectations of everybody that's involved throughout as well. The second are relationships. As you can see already from the panel discussion, you really need to invest the time in building and sustaining those relationships. And that's often a skill that gets overlooked, but is a really valuable skill. Listen and learn from others. Generally, the partners, the peer researchers, the communities you're going to be engaging with, they'll know best how to engage. They will help you. Similarly, as you heard examples there, they may want to learn from you about things like ethics. Be creative, do what works for your audience. You heard great examples of pizza, to try and relax people to start with. You heard, I think Davino mentioned a great example of zines and explained what they were. But there's tools, apps, videos, podcasts. There's so many opportunities to try and create something that works for the people you want to engage with. And also you did also hear an example of facilitating that mutual skill development. So the partners you work with might be able to teach you things the same as you might be able to teach them things. And that's true for all partners, from communities you engage through right up to MSPs, government, anybody else. And then the final R is reflect. It can be difficult to find time to do this because we're all in such a busy schedule, and it generally comes towards the end of a project. But if you can find time to think what worked well, what didn't, what you do differently next time, it will certainly help you improve. Any good knowledge exchange, in my experience, leads to more knowledge exchange. So you'll certainly notice that as well. And finally, when you're reflecting, think what has been the impact? Did you achieve the benefit or the outcome you really wanted to? If not, why not? If you did, great. Do you want to tell us about it? We'd be really delighted to share it. And also that can take time, so just have a bit of patience with that. The example I'll give, Ozzy will be really familiar with this example. I'm really pleased I chose it now because it's a research project he's heavily involved with and has made a really valuable contribution. The project is Young Men Mental Health in the Voluntary Community Social Enterprise Sector. Will Mason, as Ozzy mentioned, leads the research team, and Ozzy is really heavily involved as a partner, a vital partner in the project. It's a really nice project, as you've heard from Ozzy, about how they've interacted and worked together and really built that research together. But I'll probably just focus on some of the outputs that have come out of it, which is extended that interaction, that knowledge exchange even further, if you like. So recently they've had a couple of news items, one of which, the second one, went on the BBC News. They've done local news, radio, and videos, one of which is the video you'll see at the bottom. Will have a link in the slides so you'll be able to watch it, and I'd encourage you. It's a really nice watch. But also alongside that, the team have been building other resources, such as creating a briefing, which actually worked out to be timed really well. Because right as they had their briefing ready, there was a call for evidence from Parliament for people to give an input into men's mental health strategy for England going forward. And I know Will and the team did input into that. I've also been supporting them to look for other people, other MPs interested in this area, and we found certainly at least one other MP who's been talking about a similar kind of project in a different area of England and how it needs support. And it may well be that collectively that could enhance that voice together, if you like. So it's a really nice project. I'm not going to talk about it anymore because Ozzy's on the call, so I'm sure he'd be delighted to tell you all about it if you want. Or I have put the link at the bottom as well if you want to learn, and you can find all the links to the outputs there as well. So in terms of support, I've kind of indicated Amy, who is the SPHR comms manager. I'm sure you're all very familiar with Amy. And I, as the knowledge exchange broker, are here to offer bespoke one-to-one help to all of you on things like news, blogs, briefings, impact case studies, events, contacts, anything really. Just feel free to get in touch and we will do our best to help you. There are also some resources that have been created to help, and I've put links in there for you. You can sign up for policy newsletters or consultation updates. That's a good way to find out what's going on and what people are interested in. And I'll happily give advice to anybody interested in doing that and where you can find how to sign up. Just simply contact us at the comms email, which is at the bottom. The two examples shown there, I think, is one's a recent news item and one's a recent impact case study, just to give you a few examples. And then finally, because I'm sure my time is getting close.
Yes, I was just about to say we have a minute left.
Brilliant, brilliant. We have, I've included a final slide that's got a few additional, more generic resources in, with links in to how to write policy briefs, how to engage with Parliament, you know, things around knowledge exchange that hopefully will be of use to you all. So I think I finished, Joyce.